How do different dialysis types affect CKD bone health? Imagine your bones as a sturdy house that needs the right balance of nutrients and hormones to stay strong. When your kidneys aren't working well, that balance gets disrupted, leading to bone problems. Dialysis helps remove waste and excess minerals, but the type of dialysis you get can influence how well your bones stay healthy. In chronic kidney disease, your kidneys struggle to activate vitamin D, which is essential for absorbing calcium from food. Without enough vitamin D, calcium levels in your blood drop, and phosphorus levels rise because your kidneys can't remove it effectively. This imbalance triggers your parathyroid glands to release more parathyroid hormone, which pulls calcium from your bones to keep blood levels normal. Over time, this can weaken your bones and increase the risk of fractures, a condition called renal osteodystrophy. Now, let's look at how different dialysis methods impact this process. Hemodialysis is the most common type, usually done 3 times a week. It effectively removes phosphorus from your blood, but often not enough to fully control its levels. Because phosphorus remains high, your body keeps releasing parathyroid hormone, which can lead to high turnover bone disease. Hemodialysis can also cause fluctuations in mineral levels between sessions, making it harder to keep everything balanced. Sometimes, doctors give vitamin D analogs or calcium-based phosphate binders to help, but overuse of these can cause other issues like overly suppressed bone activity or calcium buildup in blood vessels. Peritoneal dialysis, on the other hand, is a continuous process that uses your peritoneal membrane in the abdomen to filter waste. Since it happens daily, it provides a steadier removal of phosphorus, which may help keep mineral levels more stable. Some studies suggest that peritoneal dialysis patients might have a lower risk of certain bone problems compared to those on hemodialysis, especially if phosphate levels are well managed. However, both types requiring careful monitoring, because mineral imbalances can still develop if treatments aren't tailored properly. Medications also play a big role. Doctors often prescribe vitamin D receptor activators to lower parathyroid hormone levels, but these need to be used carefully to avoid high calcium levels or vascular calcification. Cinacalcet is another medication that helps lower parathyroid hormone more effectively and can improve bone health. But overdoing calcium-based phosphate binders or vitamin D supplements can sometimes lead to adynamic bone disease, where bones become too weak because of suppressed activity. Monitoring is key for everyone on dialysis. Regular blood tests for calcium, phosphorus, and parathyroid hormone help doctors adjust treatments. Bone density scans and tests of bone turnover can guide therapy to prevent both overly active and underactive bone disease. Proper nutrition, including phosphate control and adequate protein intake, also supports bone strength. While dialysis mainly affects mineral and bone health, it's important to remember that patients with kidney cancer may also face changes in mineral metabolism, especially after surgery or systemic treatments. Keeping bones healthy is vital for overall well-being and quality of life. If you're on dialysis or have CKD, talk with your healthcare team to develop a personalized plan that keeps your bones as strong as possible. Remember, every person's situation is different, so regular checkups and tailored treatments are the best way to protect your bone health.